Hello, and we are live. It is currently 8 p.m. We made it, ladies and gentlemen. I rushed here, but we definitely made it. It is February 27th, 2024. I can't believe it's almost the end of February. We're welcoming the nice month of March, which is Women's Month, because International Women's Day is in that month. And also, Ramadan is also in that month. So it's a holy month and it's a Women's Month. And in Islam, women are known to be attached very closely to the divine, so it actually makes a lot of sense. But we're not talking about that. We're not talking about anything religious. We're not preaching. We're preaching about teeth. And we're continuing on from yesterday's topic, which was this: why your teeth keep getting worse, even if you see the dentist regularly. And we talked about abfractions. Let me just go through this really quickly. We talked about how your teeth can look like this if you're not careful, and how you can prevent it from looking like that. We also talked about these things, which are abfraction lesions, which I see literally on a daily basis. I kid you not, and every dentist sees it on a daily basis. And it has very little to do with your toothbrushing and whether or not you're wearing a night guard, and it has something to do with the way that your bite fits together. And we talked about compensatory eruption, which is basically this phenomenon where your teeth shift up, and you see here the gum level on the bottom teeth, on the bottom front four teeth are not the same as the other teeth. They're all the way up. And we saw some examples of people that have gone through and fixed their bite. And so they've decreased their chance severely of getting these things. So they've gone through Invisalign, and look at these befores and afters. It's absolutely gorgeous. And we talked through as well how compensatory eruption happens when there isn't any opposing force and you have all these teeth shifting. And we also talked about what happens if you don't save your teeth later on in your life. You're going to be sending an arm and a leg to have your teeth basically look like they were before they got destroyed. And just like such as this woman here that spent quite a bit, but her teeth obviously right now look phenomenal. So in order for you to save all this money, what you have to do is you have to take action, as Tony Robbins has stated. And we talked about how to stop the spending cycle. And how to stop the spending cycle is actually quite simple, and it involves 4 steps, which is understanding why your teeth keep getting worse, get your bite analyzed, and make sure you come up with some treatment plan with your dentist to get your bite balanced with orthodontics. And at Spinati Dentistry, we offer clear aligners, and then you begin your journey to true dental health. Because like we talked about, we said that form follows function. We mentioned how a hippopotamus differs from a cheetah in terms of their form. And so that's why when you look at a cheetah, they look like some animal that runs incredibly quickly, because that's their form. And so their function follows the form, whereas a hippopotamus looks fat and big, and so they're not meant to run fast like the cheetah. Same thing with your teeth. If your teeth are nice and straight and aligned, so the form follows the function of it actually working properly, and the destruction to your gums, bones, and your teeth decreases severely. But if you don't do that, if you allow your teeth to stay crooked and you stay in a misaligned shape so they're not actually fitting properly, then obviously you're inviting a lot of damage in the future, and obviously a lot of pain and cost to you. And there's definitely a solution to all of this madness. And one of them, like I said, is to understand why your teeth keep getting worse, which are these are some of these signs. And here you can see here that it says that all of these lead to unbalanced biomechanical forces, and we talked about that. And we talked about how these unbalanced biomechanical forces causes this undue trauma and stress to your teeth, and causes these enamel rods to crack. And then you get recession here, and you get abfraction lesions. And these things are incredibly notorious for let's just say, not being friendly to you in terms of increasing your sensitivity, increasing pain, increasing fractures. And they look really bad. Okay? They don't look good at all. And so this is another instance here of what an abfraction lesion looks like. And truthfully, if you're to look in the mirror, more than likely, a lot of you have this. So again, it has very little to do with your toothbrushing or night guarding. Not to say it has nothing to do with it, but it's got little to do with it and a lot to do with how your teeth are meeting. As you can see here, this diagram talks about the force vectors, the tension, compression, the thickness on the lingual bone, and the thinness on the buccal bone. The buccal bone is the cheekbone, lingual bone is the bone near to the tongue. And so it is incredibly expensive to fix. And when you get to that stage, when your teeth look like this, basically all you can do at this point is put a filling. And the filling obviously doesn't last very long, because if your tooth structure didn't last, so what makes you think something that's synthetic is going to last? So it's not going to last very long, and you get into the cycle where eventually you're going to start losing these teeth because they're going to fracture at a rate where you're not going to be able to save it. And then you have to fork over implants, and an implant right now costs between $4,500, actually probably around $5,000 to around $7,000, depending on what kind of how complicated it is. And if you need more bone grafting and gum grafting, it'll cost a lot more than that. So with aligners or with orthodontics, just one implant basically covers the cost. And really, with aligners, you're saving your entire mouth. So it's not just one tooth, whereas the implant is just one tooth. But with aligners, you're actually saving your entire mouth, and you're saving a lot of disappointments in the future. And also the cycle of fillings needing to be redone over and over again because of this. And I showed you guys this yesterday with regards to someone having some extreme case of fraction and recession and bone loss. And here you can see, I mean, this is an actual picture. This is not my patient's picture, but one of my patients actually, two of my patients actually have very similar profile to this. So it's not like something that was made up or AI generated or false. No, this stuff actually happens. And you can see here that the bite of this person isn't correct, right? They have what we call an edge-to-edge bite. And so when we keep going, we see here, the examples of restoring and repairing these things cost a lot of money. Like if you're talking about crowns, you're talking about implants, we're talking about like in the $20,000, $30,000, $40,000 if you're looking to restore all this stuff. So it costs a lot of money. And still, if you do that, your bite is still not fixed. So although you're spending all this money to put crowns and whatever, your bite's still not fixed. So why not fix it from the get-go? So here you can see the wait and see approach. When people say to me, they say, they tell me, well, it doesn't hurt right now. Nothing hurts. We'll just wait until it hurts. Well, that's called the wait and see approach. The wait and see approach is a problem. The reason it's a problem is because you're waiting for a problem to happen. And amongst many other dentists, I would say all dentists, are warning you and telling you, fix your bite. Fix your bite, because if your bite's not balanced, if it's not fixed, if you're biting improperly, if you have a anterior deep bite, if you have a cross bite, if you have, edge to edge bite, if you have a, your jaw is too far forward, or your jaw is too far back, or whatever it is, your bite is not balanced. And if it's not balanced, you're, as they say, you're cruising for a bruising. So the best way for you to fix this is for you to fix your bite. So make sure you see your dentist and ask them about your bite and get them to do a bite analysis. And if you don't have a dentist, if you're watching this, I am your dentist. And you can easily call us and you can email us, but this is not the point. Okay. The point is that I want you to save yourself from having this kind of scenario happening to you. So here you can see this is called a stepped incisal-plane, which is what compensatory eruption is, or compensatory eruption looks like. And here you can see there's a huge step. Okay. And the reason is because all these teeth have nothing opposing to them, right? So if we look at this, you can see here, this person here has a complete overlap on their front teeth. This is what we call a deep anterior bite. And you can also see some signs of fractional lesions. And on those lesions, you can see some cavities happening. Okay. And here you can see, because of the deep bite, they have nothing in terms of the opposing dentition, nothing's hitting. And so these teeth are shifting, they're moving up. And so now you have this incisal step. Okay. So get your bite analyzed. Now, getting your bite analyzed, of course, you can book your appointment at Cincinnati Dentistry. We analyze your bite, the position of your teeth in relation to the arch, and in relation to each other. We analyze any damage that has happened so far, such as fraction lesions, gum recession, bone recession, cross bites, and so on and so forth. We share our findings with you and develop a treatment plan to balance your bite. And then we come up with a treatment plan for you to balance your bite properly. Now, after your oral health and bite are analyzed, a comprehensive treatment plan is made for you. You'll be shown how treating your bite will improve your oral health. We'll actually have a simulation for you. And then you begin your journey to true dental health. Now, there are three options to get your balanced bite. It depends on the number of teeth that you have and severity of current trauma to your teeth, gums, and bones. The number one is orthodontics using clear aligners. Okay, now if this is in the early stages, so if it's not severe, then you can definitely get aligners. If it's option two and the damage has been too much, such as some of the examples that I've shown you, then you have to consider crowns, bridges, and implants. And the option three, which a lot of my patients have gone through, which is a combination of orthodontics, so aligners with prosthodontics, such as crowns, bridges, and veneers, and implants. Now you have the first option here. This is an example. So here, this person here has crowding. They have, this is on the left is the before, the right's the after. They have some crowding. They have some misalignment of the gums, misalignment of where their teeth are. And so the after here, you see that's perfectly aligned. This is with aligners. And you see some bonding that's been happening, very simple bonding, and their teeth are restored to natural shape and function. Now here, this is an example of a person that will not benefit from orthodontics because their teeth are destroyed. And so if you're in that camp, then you don't have much of a choice. You're in option two. So your only option is crown, bridges, and implants. And it's going to cost a lot, but if you don't fix it, it's only going to get worse and your oral health will not become better. Okay, so we do offer payment plans, and we have a tremendous good payment plan for people of various different options. So you can pay it monthly based on your budget, and you choose your payment option. So it's actually very, very affordable for you to actually fix your teeth. You don't actually have to fork over tons of cash all at once. This is another example before and after. So you can see here, you see a lot of crowding, deep bite, and then we fixed it. We fixed the whole thing, and we did some veneers. We put an implant in. So we did a lot for this person. But you can see, like, your teeth can definitely be saved. Now, to give you a quick recap, a bad bite will cause you to have detriments to your teeth, gums, bones, and bite. If the watch and wait approach, which we talked about, is incredibly expensive and will cause your teeth, gums, and bones damage. To stop the progression of this damage to your oral health, you have to start by getting your teeth analyzed. So you have to begin your journey to true dental health today by starting this process. So are you looking for oral health that will last you a lifetime? Teeth that will not get significantly worse year after year? Gums and bones that will not recede over time? Preventing costly dental treatment? Teeth that will not groove and cause abstraction lesions? A solution that will help you smile with confidence? You have two choices. One, you can go and do it on your own, which will only damage your oral health even more. And by the way, Direct Smile, the SDC, the Smile Direct Club, has gone bankrupt. So I don't know where you can get this done by yourself. So, but anyway, it's not a good option ever. But you can try to do it by yourself. I don't know how, but I thought I'd put it there as a choice. The second is you can allow us to help you gain control of your oral health, your spendings, and increase your confidence in having functional teeth that will last you a lifetime. Fixing your bite today will prevent costly oral health problems in the future. And this is the end of this series of how your teeth will keep getting worse if you don't get your bite fixed. Now, there is a third part to this webinar, and this is when I discuss certain things, but that's going to be exclusive to those people that actually attend the webinar. So there's going to be a webinar exclusive. There's going to be exclusive deals specifically for those people that attend the webinar. So look forward to the announcements of the webinar. But nevertheless, I do just want to let you know that if you aren't getting your bite analyzed, this is the first thing that you should do if you are a person who cares about their oral health. And as you know, the oral health is connected to the entire body. And so good oral health is a start of really good health. And there's a lot of connections of poor oral health with a lot of systemic diseases. And now they're even linking it to things psychologically and actually things like dementia and Alzheimer's and whatnot that are linked to having bad oral health. You know, things have been linked such as, heart disease and whatnot to poor oral health. But now the research is actually extending. And so it becomes really important in order for you to live a satisfying life that is healthy and has a decreased risk of disease as you get older, for you to take care of yourself and take care of your health and take care of your bite. If you have any questions at all, I am here for you. I forgot to announce that today, just because I got on straight up at 8 p.m. because, I did promise you that I'm going to do 8 p.m. lives starting as of yesterday. And the 8 p.m. lives are Sunday all the way to Thursday. So Sunday, Monday, Tuesday, Wednesday, Thursday. And then Friday and Saturday are going to be variable times. They're not going to be specifically at 8. They may be at 8, but they're going to be variable. So that's why when I hopped on, I was like, I need to get going because I promised you, and I like to keep word. I like to keep my word, and I like to keep my promise. But what I forgot to mention is that today is podcast number 40. Yes, today is podcast number 40. It is a very special day because this is the 4th Deca podcast that I've done live starting 40 days ago. And it's been a journey. It's been one heck of a journey. It has not been easy at all. Just like starting, a fitness program or starting anything new or starting a new career or starting school for a long time. If you've never been to school or if you haven't been to school in a very long time, it's kind of like that, right? There's a lot of challenges. There are a lot of things that, you look at and you're like, okay, I need to improve on this. I'm not doing well there. There are some things here and there, and it's a constant improvement. So I'm not saying that I've reached my plateau. I'm not even close. But I'm just saying that the struggles are definitely there when you start a fitness program. I remember when I first started my fitness program, years ago. I remember I was lifting just the bar and 25 and 25 on each side. I was struggling and I didn't have much balance. But then day after day, month after month, year after year, I got stronger and stronger, and people look at me now and think I've always been in shape. And no doubt that's going to happen when I do continue on doing this podcasting and inviting more guests and having more interviews and talking to people. There's going to be a drastic improvement in the way that things are done, and I'm looking forward to that. I'm looking forward for you to see the improvements as well. So today is podcast number 40. Now tomorrow is February 28th, and February 28th is Tooth Fairy Day. So if you know of anybody that is losing their teeth, be a little bit more generous and give them a bit more money under their pillow as their favorite tooth fairy. And the day after that is the Leap Day, which is February 29th, and that's a Thursday. So happy Leap Day to you. Tomorrow we'll be talking about a very special topic. I'm not going to mention it now, but oh, you know what? Heck, I'll mention it. We're talking about xylitol. Okay, so I'm going to be mentioning xylitol because I am addicted to something called xylitol gum. So I'm going to talk about the benefits of xylitol, whether xylitol is bad for you or good for you, how it works and all this stuff. So, and it's one of those tricks that you want to learn so that you can have better oral health. It's one of those things that really, very few people actually talk about. So I'm going to mention it, help you benefit. And if you have any questions or concerns or any comments, make sure that you DM me and you leave them, and then I will respond. And if you have any suggestions with regards to topics that you want me to talk about in the future, make sure that you suggest them to me because I'm open to any suggestions at any time. Thank you so much for listening, and thank you for your time. I hope you're doing well. Stay well, and always, as always, keep smiling. Now, before I keep going, I always forget to read these comments. And, I look at these comments and I'm, I don't read them. But here it says, is that true? I hear lots about fluoride is bad for you. Hanny says, I swear I saw the tooth fairy when I was young. I had a high fever though. Funny. Xylitol is so good for you. Yes, pure gum. Yeah, I'm addicted to pure gum. So no, fluoride's not bad for you, but if you want me to talk about controversial topics, I can talk about controversial topics. All good. But leave them in my inbox or, in any of the comments. I'll get them in any of the posts. Thank you again for watching. Have yourself a great night.